Alright, so I'm just here to assess my newborn right now. I verify their identity with the mom, and I have on my supplies, I have measuring tape, my pen light, my stethoscope, I have gloves, and then hand hygiene because this baby has not had their first bath. So I'm just gonna do hand hygiene, then I'm gonna wear gloves while I do this assessment. The baby is in a radiant warmer right now because their temperature regulation is not very good when they're a newborn. So it's important to make sure they're warm. So they have a hat on, they're swaddled, they're in the radiant warmer. But when I do this assessment, they're not gonna be swaddled, obviously. Just gonna put my gloves on. And I'm also gonna make sure my stethoscope is warmed before I when I touch the baby with it, or when I auscultate the lungs and then the heart rate. Just gonna get my stethoscope ready. I'm just gonna get the baby all unswaddled first. I'm looking at the baby's posture to see if there's any flexion at the elbows right here, and then at the knees and at the hips. And there is. And while the baby is like that, he's quiet right now. I'm just gonna warm my stethoscope before I place it on the baby's chest and listen to the heart rate. And I'm gonna listen to the heart rate for a full minute. And I'm gonna do it at the apex, which is like right here. And you wanna do this when the baby's quiet and not crying. I will listen for a full minute. The baby's heart rate is 145 beats per minute. And then at this point, I'm gonna listen to the lungs. I'm gonna do this side. I'm listening for like adventitious signs like bronchi, crackles, or any wheezing. And what I'm also doing is I'm looking at the respirations, and with the respirations of a baby, their abdomen is going to be moving more since they breathe with their diaphragm. And I'm gonna count the respirations for a full minute. And then I'm gonna get more on the side for the other lower lobe. And respirations for a newborn should be between 30 and 60 breaths per minute. And what I'm getting with this baby, the respirations are 50 breaths per minute. And while my stethoscope is on, I'm also gonna listen to bowel sounds. I'm gonna start in the lower quadrant, and then you would listen to all bowel sounds. Now that I listened to the baby's bowel sounds, they're all active in all 4 quadrants. And now what I'm gonna do next is I'm looking at the mucous membranes. I'm gonna get my pen light. I'm seeing if they're pink and moist, and it appears they are. And then what I'm gonna do now is I'm gonna look at the skin. I'm looking for any lanugo, Mongolian spots, any cyanosis, agrocyanosis. I'm not seeing any in the extremities. The baby looks pretty pink. And I'm also not seeing any jaundice on the baby. All right, now I'm going to assess the turgor of the skin. I'm just gonna gently pinch and then see if it goes back. And it does, so the baby has good turgor. And now I'm gonna get measurements of the baby's head, chest, and get the length of the baby. I'm gonna do centimeters. So what I'm gonna do is I'm gonna take off the hat. I'm gonna do it right above the base of the eyebrow. And then I'm just gonna wrap around the baby. And it should go to the back of the head. And this baby is looking at 40 and a half centimeters for the head. Just gonna make sure that it's in the fullest part of the head. And it is. So 40 centimeters, and the chest should be about 2 centimeters smaller. And while I'm also doing this, I'm gonna look at the nipple development. For this purpose of this video, this baby does not have nipples on right now, but for a real baby, I would measure the areola. So I'm just gonna measure the chest from the fullest part to the back of the baby. And it looks like this is 37 centimeters, so that falls within the measurements. And now I'm going to do the length of the baby. We're going to start from the top of the head down to the heel. Just going to start up here and go down to the baby's heel. I got to get them straightened out. Looks like the baby's length is about, I would say, like 50 centimeters long. And then I'm gonna go put all this in the chart. All right, now what I'm gonna do is I'm gonna palpate the fontanelles and the sutures of the baby. So I'm gonna gently pick up the baby and support their head. I'm gonna feel the one suture up here. I'm gonna feel the parietal fontanelle over here. And then just palpate if it's in between. I'm also gonna be looking for caput. This baby does not have any caput from labor and delivery. And this baby does have a fontanelle. It's soft, palpable. Okay, so I'm gonna put the baby back down. I'm also gonna assess the facial symmetry. So the eyes line up with the pinna of the ear from the outer canthus to the pinna of the ear. The baby cries symmetrically. I'm not seeing any one side. I'm not seeing any facial drooping. I looked at the ears. I'm also gonna test the hearing acuity by clapping, and the baby would react and cry. And the baby reacted. I'm also gonna look at the nose for symmetry. I'm not seeing any asymmetrical features, and then I'm going to occlude one nostril for nasal patency. I'm also gonna make sure the baby's mouth is closed. So I'm just gonna put my finger in there and they can suck on it. I'm gonna occlude one nostril, and then I'm gonna see if air is coming out, and there is air coming out, and then I'm gonna do the other nostril, and there's air coming out of that one too. And then I'm gonna check the rooting reflex, which is how good the baby sucks on my finger. And then I'm gonna touch the side of the cheek, and the baby's mouth should open, and it did open. Again, with the strength of the fingers. Then I'm gonna palpate the gums. They all feel good. And then I already assessed the mucous membranes of the baby, but if I didn't earlier, I would do it now since I'm looking at the mouth. And then I'm going to assess the neck. The baby has a lot of skin folds. I'm going to palpate for any masses or any swollen features, lymph nodes. I'm not feeling any. I'm going to grab the back of the baby, feel some more. I'm not feeling anything. And then I'm going to check, and then I'm going to turn the head from side to side to assess range of motion. Obviously this is a mannequin doll, so the baby's head really can't turn that far, but in a real baby, the head would be able to turn 180 degrees both sides this way, so that way all the way, then this side all the way. And then I'm going to assess the integrity of the clavicle, because normally in a vaginal delivery, the clavicle is prone to getting a fracture, so I'm just going to palpate the clavicles, and they all seem good. And then I evaluate the breast development. On a real baby, they would have the areola, the nipples, but on this baby right here, we don't have nipples right now. I'm going to note the roundness of the abdomen. The abdomen is more rounded. And then I'm going to assess the umbilical cord. I should see 2 arteries in 1 vein. And I see the 2 arteries in 1 vein. And now I'm going to palpate the abdomen. I'm going to start in a clockwise motion, so I'm going to start soft, just feeling for any masses or any discomfort that the baby might feel or cry more. And then I'm going to go deeper. I'm going to feel for the liver border. And I'm not feeling any abnormalities. All right, now I'm going to assess the femoral pulses. So I'm going to take off the baby's diaper, pull it down. I'm going to assess the pulses, the femoral pulses. They're strong, +2, both the same on both sides, and I'm going to compare it to the brachial artery. And they're both same with the brachial artery. And this is a boy, so I'm going to assess the foreskin of the baby. This baby has not gone through circumcision yet. Foreskin looks good. I'm going to look at the scrotum. There's a lot of rugae on the scrotum, and which is normal and an expected finding in a boy. And now I'm going to test the patency of the anus. So what I'm going to do is I'm going to lift the baby up, and then I'm going to pass my finger near the anus, and it should flex. And it did flex, so I'm going to put that back. And then I'm going to put the baby's diaper back on. And I'm going to make sure that the diaper isn't covering the belly button where the umbilical cord is, because we don't want it to get irritated or bleed anymore. So we got to make sure the diaper is pulled down. And now I'm going to turn the baby over. I'm going to put his hat back on because babies suck at temperature regulation, so I'm going to put his hat back on so he stays warm. I'm going to turn the baby over, and I'm going to assess the scapula. And I'm just making sure the scapula is symmetrical. I'm looking at the head for any signs of trauma, like caput or subdural hematoma, and I'm not seeing any of that. I'm also going to assess the spine and palpate the vertebrae, and I'm feeling all the vertebrae. I'm going to turn the baby back down just for a second. And then I'm going to look at the gluteal folds. I should have kept the baby's diaper off. So we're going to look at the gluteal folds, and they should be symmetrical, and they look good. I'm not seeing any deep dimples in the gluteus. And then what I'm also going to do is I'm going to get my stethoscope again, and I'm going to listen to the breath sounds in the back of the baby. So I'm just going to turn the baby over again. Just going to start up here. I could also do it on the baby's side as well. So just start over here, count for 1 minute again. I'm not hearing any crackles, rhonchi, wheezing. The rate is still the same at 50 breaths per minute. All right. Baby seems good with breast sounds. All right, now what I'm gonna do is I'm gonna feel the shape of the bones in all of the baby's extremities. So I'm just feeling for any abnormalities in the arms, check range of motion in the shoulder, the wrist, the hands, full range of motion in the upper extremities. Now I'm gonna do the legs, full range of motion in the hips, the knees, the feet, and then I'm gonna count the number of digits on the fingers. So 1, 2, 3, 4, 5, which is good. 1, 2, 3, 4, 5 in the other hand, and then I'm gonna count the toes as well. 5 toes on one foot, and then total 10 toes, 10 fingers. So sounds good. I'm not seeing any polydactylies. And now I'm gonna do the palmar grasp reflex. I'm gonna stick my finger right here, and the baby should grab my finger, which is an expected finding. I'm gonna do the plantar reflex where I put my foot down here and the baby's toes should grab or flex around my finger. Then I'm gonna do the Babinski reflex, which is where I start at the bottom of the heel, I go up and the baby's feet should flex. And they do that on this other foot. Yeah, Babinski reflex is good. And then I'm gonna do the Orlani's test, which is where I assess for any hip dislocations. I'm not seeing any, I'm not hearing any cracking in the baby's hips, so I'm not seeing any hip dislocations. I have no positive findings for that. I'm gonna put the baby's diaper back on. And it's also important if the baby's crying then to just like comfort the baby, because I know this assessment took a while and they're not gonna be happy with me. And then finally I'm gonna do the Moro reflexes where I drop the side of the bed to see if the baby flexes and reacts. I'm just gonna drop it slightly and the baby flex. They made a C shape with their fingers, would be an expected finding. So now that my assessment is over, I'm just gonna re-swaddle the baby for comfort, and then I'll return the baby back to mom for skin-to-skin contact.